You're juggling it all: work, family, decisions, expectations, 6 hats, maybe more every single day. But behind the scenes, your body is running on stress, and stress left unchecked will lead to illness. I'm Dr. Shami, an integrated family doctor, and this is 6 Hats, the podcast that helps you understand what stress is doing to your body and what you can do about it now. Hello, everyone. Welcome back to the 6 Hats podcast. And in this episode, we sit down with Dr. Perri Carlson-Hawke, a leading metabolic psychologist in Australia, to explore the powerful link between mental health and metabolic function. Now, Perri is going to share her personal journey, how she became so passionate about mental health, nutrition, and the often overlooked role of metabolic health in emotional well-being. So welcome, Perri.
Thank you, Shami. Thanks for having me on.
So, Perri, when I found out about you, and I think it was perhaps through social media, I got so excited because there are not enough psychologists out there who even mention the word nutrition. And it's so important. And I just want to get this message across to as many people, because you can't just talk about your problems. You've got to feed your body, you've got to feed your mind in the right way. And I know from my own experience as an integrated GP, it just transforms your health, your mental health, especially when you really look after your nutrition. But I love how you've gone into metabolic health, because I see a lot of insulin resistance. And I was at a conference over the weekend, and Gary Fettke said about 92% of the population is now most likely insulin resistant, which totally scared me, because I go, wow, so how many people are actually not feeling great, could be feeling so much better? So there is this whole spectrum. So I'd love to start with your story, because it's so unusual to find a psychologist into nutrition.
You're right. There aren't many of us in Australia yet, but we're growing. Certainly internationally, we're growing. I think, I've always been, for as long as I can remember, I've been always interested in nutrition and holistic health. I think I read a David Suzuki book when I was 15, and it really shifted my perspective somehow. But I'm a clinical psychologist. I've been practicing in private practice in Australia for more than 10 years now. And since 2020, I've really focused in on the role of nutrition, because you're right, it is often overlooked. And we do forget that brain is part of the body, and that mental health is actually brain health, and that nutrition is an essential part of having any kind of stable mental health. And you're right, that insulin resistance, and that it plays a role in the way our brains use energy. And that, of course, has an impact on our mental health, the types of thoughts, our emotions as well. So, it's a big topic, it's a big, broad area, but for a psychologist who sees someone every day who struggles with even mild levels of mental or emotional disturbances or severe mental illness, it becomes more and more important to look from a systemic, holistic level of what is going on and how can we help people struggling with these conditions. Traditional psychotherapy is fantastic and effective for many, many people, and I practice it every day as a psychologist. It helps people manage their unhelpful thoughts or thought patterns, maybe change their thinking. It helps them manage unpleasant emotions, overwhelming emotions, and these are really important skills to learn. What traditional psychotherapy tends not to focus on is what causes these distressing feelings and thoughts in the first place. We're kind of taught in clinical psychology in your training that it's genetics, and genetics is kind of what causes mental illness, and you can just kind of help people manage it, right? But taking a metabolic approach, we can see that there is a way for people to stop experiencing these distressing emotions in the first place. We cannot choose the emotions we have. We cannot choose the thoughts that pop into our brain. And many of us feel we can't control that. However, lifestyle, neurobiology, biochemistry plays a big role in emotion regulation, in the types of emotions people experience, the intensity of emotions people experience, and the nature of their thoughts. Whether someone has obsessive thoughts or very negative thoughts or intrusive thoughts that they just can't put down, people can influence that through their lifestyle, through sleep, through stabilizing their metabolism and their energy production, in their brain and through reducing other factors like oxidative stress and inflammation, systemic inflammation.
Amazing. You're so speaking my language. I love it. I love it. I want to break it down even further because not many people actually understand what metabolic health is. How would you explain that to our listeners?
Metabolism is energy production. It's your ability for your body and your brain, which I include as part of the body, your body and your brain to use the energy that you give it. Metabolism is an incredibly complex system to understand. I do not attempt or claim to understand all of it. It is incredibly complex, but we know that it is essential in energy production for our brain and our body. And so when energy production is destabilized in any way, be that from chronic stress, prolonged stress on the brain and the body, be that from exposure to toxins like chronic alcohol use or drug use, or from the brain's inability to use the glucose that you're giving it through insulin resistance, then these cause a number of metabolic problems. We know that in mental health, it shows up in a range of different presentations. So we talk about the role of cerebral glucose hypometabolism. We talk about in mental illness, reduced ability to produce BDNF, right, in the brain. We talk about neurotransmitter imbalances. We talk about, gosh, I'm drawing a blank now.
I want to go back because not many people understand insulin resistance.
Okay.
And I quickly sort of say is what's really important, you can have a normal fasting glucose, but a high fasting insulin. And it's really important. So not many people do the test. So they think, great, my sugar is great, I'm doing fine, but you can have this high fasting insulin. And that fasting insulin times glucose divide by 22 will give you a score. And if that score is less than 2, you don't have insulin resistance. But if it's over 2, you do have insulin resistance. But I always want to go lower on that fasting insulin, hit it around 7 or below. And insulin resistance literally means insulin's not working well. So it's not pushing sugar into the cells. But more importantly, when it comes to brain health, insulin's not crossing the blood-brain barrier to push insulin, such sugar into the cells in the brain. And that's how it's connected to mental health. And I think that's so important to mention. But you mentioned BDNF, and that's brain-derived neurotrophic factor, which I love also talking about, and how would you describe that, BDNF?
Describe BDNF?
I use it as a fertilizer for the brain where it's like new nerve connections. It increases with sun exposure and exercise. And it's so good for, mental health as well. But I just loved what you mentioned, how it's actually all interlinked to mental health. This is where we're coming down.
So things like problems with producing BDNF in the brain, or glucose hypometabolism, or glutamate excitotoxicity, if I can get that word out. All of these things are common to mental illnesses, and they are all things that are improved through therapeutic carbohydrate restriction or something like a ketogenic diet. They're even improved in many people just by reducing the amount of processed foods and eating a more whole foods diet. It's amazing the difference that people experience by eliminating things like processed sugar and processed flour and alcohol from their life, regulating sleep. I often tell people who come to see me, you can get so much more benefit from stable nutrition and stable sleep than you'll ever get from just talking for an hour a month or an hour a week with a professional. This is helpful, but the real change comes through the behaviors.
I love it. Absolutely love it. And you just made it sound actually so simple and achievable. And often we don't link, like the number of people I see who are just not sleeping well through the night. And I think the last data was like 40% of Australians are sleep deprived. And can you imagine what that looks like? Of course, it's going to affect your choices in the day. And often we start with coffee. The number of patients would say, I need my coffee just to get started. And it's this whole cycle. And when you are stressed, you're more likely to go to sugar. You're more likely to snack all day. And it is that stress eating. So you get caught up in this cycle, which then affects your mental health, and the whole cycle starts again.
Yes. When you're stressed or emotions are high, your thinking becomes quite short term, making almost like threat detection thoughts or decisions where, well, I'll just drink coffee. And you forget, actually, I haven't eaten breakfast today. The number of people I meet who breakfast is one of the first things to go on a busy day.
Oh, true. So true. So I would love to know how you approach your clients because you've got this amazing knowledge about nutrition and you know the impact it has on mental health. How do they see it? So they're coming to see a psychologist and all of a sudden they're hearing about nutrition and lifestyle. How do they take that?
Some people are more receptive than others, obviously. I meet people where they're at. Some people purely they're very clear about their goals and this is what I want to work on, which is fantastic to have someone so clear and motivated. And other people are more open and they're just not even really quite sure what the issue is. I had a woman recently who I'd only first met a few months ago, and she's about my age and studying medicine and very highly functioning woman, very busy, of course, and couldn't really figure out, like knew she wasn't well, but really couldn't figure out what was going on. She'd have days where she felt like really productive and everything was going well, and then days where she couldn't really peel herself off the sofa, just wiped out and exhausted. And it's really drilling down and just asking questions about someone's life. When do you sleep and what's your sleep like and what's your diet like and how much are you drinking or not drinking or how much are you working? What's your support system like? Are you socializing? Because, social connection is a big part of who we are. Who are you spending time around? What's your environment like? And just gauging, how receptive they are to, okay, well, would you consider, cutting down on how much you're drinking? Or what would that be like for you? People only really find out how addictive some of these things are when they try and cut down. I think a lot of us, anyone who's tried to quit sugar can tell you how absolutely addictive it is. And so things like just discussing kind of where they're at and what their goals are. And this is often the best path. This is the most evidence-based path to, if you want to stable your energy levels and increase motivation and have good sleep and be able to concentrate and focus. And after, this particular woman, only after 2 weeks of eradicating, she didn't go keto or do anything extreme. She just really stopped drinking, which wasn't that difficult. She was a social drinker. That was fine. And she cut out sugar, processed sugar. She still ate a lot of fruit and a lot of carbohydrates, but cut out kind of processed food, stopped the Uber Eats, kind of takeaway food and the 7-Eleven food. And in 2 weeks significantly reduced anxiety. She was starting to have like almost close to panic attacks in the workplace, which is incredibly scary for people to experience. That hadn't recurred at all. So reduced anxiety, improved sleep, concentration was up, motivation was there. And once people have increased energy and motivation, they're far more able to engage in the types of behaviours that they know work for them. So if this is someone who wants to start walking 3 days a week, or they want to start socializing more, but they don't feel like they have the energy or the bandwidth, the emotional bandwidth to take on anymore, they find that making these changes actually allows them to engage in the behaviors that help them stay well.
I love
So it really depends on the presentation, but even small changes and just starting small, I think, is the way to get in.
I loved what you said, just 2 weeks.
Yeah, 2 weeks.
Was significant. And I think it gives so much hope to so many people that it actually doesn't take long. And I loved what you mentioned about coffee and alcohol and talking about the addictive nature, because I share that same experience because I know it's an addiction when they go, please don't take that away from me. And coffee's a hard one. And, alcohol is a journey by itself. Again,
yes.
People have got this strong relationship with it. And I think especially for women, it may not come up into a conversation with a healthcare professional for a while until you feel it's trusted, and then it sort of comes into play where actually, do you know what, I am drinking every night and maybe I can cut down. And I really want to get this conversation out there because many are drinking sort of alone at home and it's almost convincing themselves it's okay, but actually it is affecting their quality of sleep.
People don't realise that it's affecting their life because it's like this slow creep. As your tolerance to alcohol builds up, you need more to get the same effect. And so people slowly start using more and more. And it is so, in our Australian culture, it is so socially acceptable. It's far more socially acceptable to have a drink than it is to not have a drink sometimes.
True.
Yeah. And so it's not something that people really talk about, and that's not really identified as an issue. They might can be so used to waking up feeling that way, biggest thing people tell me when they stop drinking is that they no longer have that tightness in the chest. It's a real physiological anxiety that alcohol produces in people, and they just wake up like that and they kind of get used to it over the years. But it's a profound shift if you're able to cut back. I can speak with confidence about caffeine addiction because I certainly know that my brain is definitely caffeine adapted, and I find it very hard to live my lifestyle, I think, and cut back on caffeine at the same time. I think I need to go away somewhere and detox for 2 weeks and
I'm so
experience the brain fog and the headache.
I'm so glad you brought up caffeine because, I see so many patients with anxiety, and that's literally number one on the list. And I have to say to them, if you've got these symptoms of anxiety, which are disabling, you've come to me for some support, you have to look at caffeine intake. How do you navigate that conversation with caffeine and anxiety?
I think it depends on the type of anxiety. It also depends on how the person experiences their anxiety. So some people experience it really cognitively, like racing thoughts and uncontrollable worry. Other people feel it really physiologically. And they might be the first ones to say caffeine, I have a problem with caffeine because it makes my heart race and it makes it worse. Some people might be more connected, like less connected with their physiology, more connected with their thoughts. They're the ones that might be worth doing a little experiment, right? And go, well, would you like just for one day, or just for 1 week, try this? I think education is the most powerful tool when you're trying to, help someone see different options for how they might improve their health. And so giving people the options and the education, well, this is what caffeine does. And this is what the change that could happen if you reduced it. And then, it's really up to them to make that choice.
Amazing, amazing. So I loved how we mentioned caffeine, alcohol, sleep, all just really easy, practical steps that anyone can do at home. They don't need the guidance of a professional. They can actually just get started and process sugar, processed foods, and keeping it really simple. But I want to go deeper into nutrition and metabolic. How deep do you go in terms of ketogenic diets for your patients?
Yeah, so ketogenic metabolic therapy is incredibly powerful. We're talking about shifting your body and brain's fuel source from primarily glucose to ketone bodies. And when you shift to ketones for fuel, you experience transmitter balances, reduced inflammation, it optimizes energy production, and it also has a neuroprotective effect because ketones, when they're burnt or used as a fuel source, they create less reactive oxygen species, less kind of waste for the brain to clear out when you're asleep and your lymphatic system to clear out. So they're incredibly healing, but they also bypass any insulin resistance because you're not really using sugar as fuel. And so it's a powerful intervention, which it's not really diet alone when you use it therapeutically. Diet is a big part of it. Being in ketosis is a big part of it, but sleep is certainly a big part of it as also because sleep and how much activity you've done that day and how much, like even what your muscle mass is, all contributes to maybe whether you're in ketosis or not, or how high your level of ketones in your blood is. So I use it with people with serious mental illnesses. I use it with people who are they come to me and they're interested and this is something I want to try. And if they have a medical professional on board, then we're in. I tend to do a big kind of lead up to it of, okay, let's set you up for success. If you've never tried a diet before, okay, well, that might be beneficial. People, if you've had difficulties with disordered eating in the past, and that's something that we need to deal with first. Many people, if they have a nervous system condition like fibromyalgia, you might want to go in like really, really gently and slowly so as not to cause any unwanted stress on the system. So we do go quite deeply. I've worked with people living with schizophrenia and living with bipolar. These are two really debilitating mental illnesses. People with refractory and kind of atypical depression, who've had depression for 20 or more years. And we work closely, and we monitor diet, we monitor mood, we monitor sleep, and see profound change.
I'd love for you to share any sort of client stories, obviously not delving too deep, but just give our listeners an idea of what that journey looked like and how that ketogenic diet made a significant impact.
Yeah, if I think back to one woman with schizophrenia in her mid-20s, diagnosed with schizophrenia at the age of 19. And many people might not realize that when you're living with something, when you've had a diagnosis of schizophrenia, you're not in a florid kind of psychotic episode. You're still living with a lot of distressing auditory and maybe even visual hallucinations. You're experiencing a lot of what we think of as OCD, right? A lot of intrusive, obsessional thoughts that cause people or compel people to do things, to have mental rituals or behavioral rituals. It's very disruptive to concentration. It's really, imagine having a conversation with someone in the workplace or with your family, and you're just getting these very intrusive thoughts, and the content's usually very distressing, causes a lot of emotional distress. And so this is something that people live with every single day, even though you cannot see it, right? They're not displaying typical or any kind of psychotic kind of features, but that low level OCD symptomology is definitely there. And again, I've had an example of working with a client over years with this lady, and to get her to, I suppose, maybe see some value, or to get her to a place where she felt stable enough to maybe try reducing carbohydrates in her diet. We'd already worked together for her to eliminate alcohol, and that had kind of come and gone over a couple of years. You know, people, they do well for a few months and then you have a lapse. And when you're changing, a lapse is completely normal, right? It's the pathway to change. And so started drinking again, and then back onto no drinking. Sleep was still quite erratic, but she really wanted to, I mean, honestly, I think she was more motivated by a weight loss goal than she was by a mental health goal. But I think maybe I'd been going on about, the benefits of ketogenic diet and the benefits of eliminating sugar for mental illness for so long that I'd convinced her to try it. And again, I followed up with her in 2 weeks. And the first thing she said to me was that she had reduced intensity of the voices and reduced frequency of the voices. So they weren't coming as often. And when she was having them, they weren't as emotionally distressing to her. She was easily able to be like, oh, well, that's what that thought is. And it was less interfering in her concentration. So concentration improved, her motivation improved. Her sleep was still all over the place at first. But then in another 2 weeks, she started really committing to going to bed at 9:30 p.m. and getting up earlier, and then getting up and eating breakfast. I think one of the things that we work with, when people first try low carb, they forget to replace the energy with fat.
That's so true.
Where we live in such a low fat kind of culture where we've been taught that fat is bad, fat will make you bad, but the brain needs fat. And when you reduce carbs, you must replace that energy with something else. So first, she was very hesitant to introduce any more fat into her diet because she really did want to lose weight. That was the other thing she said. After 2 weeks, she'd lost 4 kilos.
Wow. Okay.
That, you have to understand, that is not really body fat. That is mostly fluid, because when you shift into a ketogenic state, where even with you reduce the carbs and the processed foods, you lose a lot of fluid. But it was enough to excite her to continue. So she's someone I continue to work with, and really has seen a lot of benefit just from slowly moving into ketosis, and now has stable sleep, goes to the gym 4 times a week, eats 3 meals a day, is doing a PhD.
Oh, wow.
She's going great.
And how long did that journey take? Did you say a couple of years to be familiar with?
Yeah.
Be comfortable?
Yeah. So I saw her pretty much fortnightly for 2 solid years before she was willing. And we worked on other things. We worked on a lot of lifestyle stuff, sleep and alcohol use primarily. Certainly diet was one. There was some disordered eating there as well. When your sleep is disrupted, guess what? Your eating goes out the window. You cannot keep to a regular meal schedule. Your appetite and satiety signaling gets dysregulated. If you're not waking up till 10 or 11, then and you're eating dinner at 6, you're still going to be hungry when you're up at midnight. So you're going to be eating at midnight. It just makes sense, but incredibly disruptive to mental health and sleep. So yeah, takes a long time to really work with people where they're at. You know, I'm not someone who's like, this is what you have to do and don't come back until you do it. Well, I'm here to work with people and to help them overcome the emotional and psychological barriers to making change, to affecting change in their life.
That's amazing. And do you know what? Before we sort of come to a close, I'd love for you to just go, right, if you had to share your top 3 tips for mental health, what would they be, like, for people just easy to implement?
Top 3 tips. Oh, that's hard.
It's hard, isn't it?
In no particular order, I would have to say sleep. Sleep is essential. We don't sleep because we're lazy. We sleep because it is neurologically necessary. Important processes happen when you sleep. It clears, and your lymphatic system is involved in this. It clears out a lot of the byproducts that your brain doesn't need. And when you even get erratic sleep, people think that sleep is something you can, if I have 3 hours tonight, then I'll just have 10 tomorrow night. But what the research suggests is that no matter how much sleep you get, if it is stable and consistent, then you'll perform better and your mental health will be better. So sleep, I'd say, is number 1. I'd say number 2 would be eating enough. I meet a lot of people. I also do a lot of work with people living with eating disorders, the history of eating disorders, and eating enough. People undereat and underestimate how much nutrition they actually need. And I don't mean calories, I mean nutrition. I mean the essential amino acids, and not just food that has anything in it that just, that's my 2,000 calories. Number 3, I'd have to say, number 3 would have to be being aware of your own, like bringing some mindfulness in to how you think, some self-awareness, some just observing, what am I feeling? What am I thinking? Like having that insight is incredibly helpful when you go about changing anything, because 2 people can have the same experience but interpret them completely differently. And that's all down to how I think about something and what is my emotional response to something. So having that awareness, I think I'd be remiss being a psychologist not to put that in.
Yeah, I love that, because I often see, we go off into life on autopilot sometimes until you have to stop for whatever reason, whether it's mental or physical. The number of times you just wake up, right, a coffee, the croissant, let's catch transport, go to the same place, eat the same thing, and you're just not even thinking. And it's just autopilot until something makes you stop. And it's really interesting. Why do we need to wait for that? Let's, create that awareness now. Go, right, what could I do differently today? Do I need that 5th cup of coffee? Do I need to munch on those biscuits, even though it's in front of me? I've been to some workplaces and it's packed with high sugary snack food. And I even went to one workplace once to give a talk, and there was this massive sign, how please snack, we got to fuel your body. And I go, oh my God, that's so, you got to go the opposite way to fuel your body, go into ketosis.
Yes.
Perhaps
Much empty calories.
Absolutely. Yeah. So that's where the messaging can be so disconnected from what you might be reading or hearing.
Yes.
And that's why it's so confusing, really confusing. So what you hear all around you, you might go, well, I am eating well and I'm doing the right things, but why am I not feeling right? And that's why it's really important to find the right practitioner like yourself to be guided, because it's actually really confusing out there. And the number of patients I've seen to say, fat is bad, or I've been trained for years, fat will make you fat, and I've just got to re-educate on that front. Or, the common things where we think snacking is okay, eating 8 times a day is okay. So it's just relearning, unlearning and relearning.
A lot of unlearning, I think, to have the capacity to relearn. Because if you don't know, you need to learn, you kind of close off to the other messages.
Absolutely.
When you start to question, you bring in that awareness. Oh, yeah. Okay, what is all this about? Why are people quitting sugar? And why do people say it's addictive and bad for your mental health? Oh, okay.
Absolutely. And unfortunately, I have to mention that, when you do see other healthcare professionals could be psychiatrists or even pediatricians, the link between mental health and nutrition is not there, and it's very quick to prescribe. And often, when specialists are not aware, they may actually say, oh, don't worry about nutrition. It's not going to do anything. I've had so many patients say that. So that's why it's important to, really take ownership of your health, get out there, follow the right people, see the right practitioners, because it can make a massive difference. And it doesn't have to be that difficult.
Yeah, that's why I love talking to people like you, Shami. It's great to have a community. I would love to find some Australian psychiatrists who are interested in nutritional psychiatry or metabolic health. And, the more GPs like yourself I meet, the more encouraged I am that we're actually shifting that traditional medical monotherapy model to maybe considering the systemic approach and the holistic approach.
Amazing. Thank you so much for your time today, Perri. Where can people find you?
The easiest way to find me is probably through my website, which is metabolic.psychology.com.au. You can email me directly there, and you can download a free guide to metabolic psychology. It talks a little bit about metabolic health and what a keto diet is and how keto actually helps anxiety. And, it's not too long, but it's free to download, and you can do that. I'm also on Instagram. I've only just started to be on Instagram. I'm quite the novice with my professional account there. So we'll see how that goes, but you can find me there.
Amazing. Thank you, Perri.
Thanks so much, Shane.
Thanks for listening to Six Hats, where it's all about progress, not perfection. If this episode spoke to you, don't wait, hit follow now, leave a quick review, and share it with someone who needs to hear it. Want to take your next step today? Download my ebook. The link is waiting in the show notes. And remember, this is general advice only. Always speak to your practitioner for anything medical. See you next time.